Hello, everyone. Um, yeah, I think we're good. We're just probably waiting for some applicants or interested parties to come see us. Thank you for joining us today. My name is Dr. Carla Evangelista. I'm one of the associate program director. Um, I'll explain how the program will go. This is our first time doing a virtual open house. Because I think it makes sense that you should all know the program first before you start sending your application. If we are a fit to you, we all know very well that it's expensive. The process of residency application is very expensive, and if the program doesn't fit, you don't have to send your application. So it's really a get to know day for us. I think the if with ERAS, it will open around September 1st, September 15. I'm not sure. I think for the program, it's September 15 that we will start to see your application. And then at this point, I think most of you are preparing your CVs and uploading documents. So when it opens, you can start assigning it to the program. All right. I think I shall start because it's 9:31. All right. So we would like to ask everybody to please to mute themselves during the session. It prevents unnecessary noises. Now, if by any chance anybody has something to say or question, we should, type it in the chat and we'll address it later. Okay? Okay, let me make it more formal now. So my name is Dr. Carla Evangelista. I'm one of the associate program directors. There's three of us in the program. And we really want to thank you for joining us. There's like almost more than 200 people registered to be with us today. I know some of you probably came from different parts of the world. Our program are known to have to cater more to international medical graduates. So we really appreciate you joining us in spite of different time zones. It is our first time organizing a virtual open house, and we all think, like what I said a while ago, it makes sense for everyone interested to get to know the program better before you start submitting your applications. The entire session will run for 1 hour, so I would like to share some guiding rules throughout the session, okay? We would like to request everyone to remain muted. There will be a question and answer portion for any clarification after the chief resident's presentation. We would like to encourage you to type in your question rather than say it at the end of the PowerPoint presentation via chat. The chief residents have prepared a very comprehensive presentation about the program, and maybe some of your inquiries will be discussed there. If by any chance, because this session is only 1 hour, by any chance there are some questions that will be left unanswered due to time constraint, we encourage you to email us at linmed, linmed at nychhc.org, or visit our department website. We try to update it as much as we can in real time. The initial part of the session will be composed of introduction and presentation of the program leadership. So you get to know what we look like, who we are, which includes the program director and the three of us associate program directors. This will then be followed by the chief medical resident slides. All right, so there's 119 of us now. So let me start with myself. My name is Dr. Carla Evangelista, and I'm a proud alumni of the Lincoln Internal Medicine Residency Program from class 2014. So go figure how old I am. I was appointed as one of the APDs in 2017, and I have been involved in several activities in the program, which some of it which includes building curriculums, evaluations, service training, instructor in our simulation laboratory, which we are known for. I am also a point of care ultrasound instructor, together with the program director. Focus is one of the favorite rotations in the program. We were one of the first in New York City to offer that rotation, and it's been active for the past, I think, 4 years now. I am the chairman of the Clinical Competency Committee, which helps the program director in making sure that the residents meet their milestones and are ready to be promoted to the next level. We also evaluate competencies of each and every resident in the program, making sure they will be ready to meet the board eligibility requirements after 3 years of training. Fun part about my job is that I organize wellness activities for the program. Wellness has been part of our curriculum in 2017. On the slides that my chief resident will show you later, it will show some scrapbook type of pictures of what we do as far as wellness is concerned. Like what I said, most of our residents are international medical graduates. They come from different parts of the world, so they're far from their families. So we make sure that they're able to cope well and somehow create a mini substitute for their families back home. My day job, I'm currently a hospitalist. I work for 6 years in ambulatory care, and I've been working as a hospitalist for 4 years now. That's what I do if I'm not dealing with a bunch of millennials like you. That's it for me. So let me introduce you to the other speaker, Dr. Vidya Menon, which is also another alumni. She's also one of the 3 APDs in the program. Dr. Menon has placed the program and the hospital in the map of research. She's been working with a lot of university hospitals and drug companies for trials and research and has received a lot of grants for the hospital and the program. So for further explanation of what she does, I'll present you Dr. Menon.
Thank you, Carla. Thank you very much. Yes, I am also a Lincoln alumni, but I'm not even going to start when I graduated. It has been that long ago. But I'm back. I've been back for almost, I should say, 5+ years. And I'm very glad to be part of this program and this department. So as Dr. Evangelista mentioned, we've been doing research very actively for the last 5 or 6 years. And we do clinical trials. We also do a lot of faculty-initiated studies which is led by the Department of Medicine faculty. They're close to about 100+ studies which are been IRB approved. We have our own IRB. Okay, I have a short presentation. I won't take too much time to just go over it. So the research department that is standalone, it is mostly medicine, but it does serve the entire hospital. I am the facility research chair for the hospital also. And can you hear me?
Yes.
Can we move to the next slide, please? Can I move my slides by myself?
Thank you. I'll be moving the slides.
Okay, thank you. Okay, so we do both quantitative and qualitative research. We've been doing qualitative research for the last year or so. We are being mentored by faculty at Columbia Hospital and Cornell, and those are two premier institutions in New York City, as you might have known. We do our research includes a lot of disciplines. We do cancer related studies. We do cardiovascular medicine, community-based participatory research, where we include community-based organizations. And you just as a little overview, I know you might know, we serve the Bronx, the southern part of Bronx, which is one of the poorest congressional districts in the United States. We serve predominantly minority population, and they are not very healthy, have an average of at least 4 to 5 comorbidities. So we do take care of a sick population. And as you know, this population is very underrepresented in research. So there is a lot of scope to do population-based studies in this group of patients. And we've been doing that. We've got a good resident support and faculty support to do that research. Next slide. We have our own, so we are one of the two health and hospitals institutions which has its own IRB. So getting a project approved is quite streamlined at Lincoln. We do have an annual research competition where residents from all multiple disciplines participate, and it's a competition which gets an award. Our residents actually are, can have a 2 week dedicated research rotation in their second year and third year. That's usually, to do focused research so that they can move their research along and get it translated into manuscripts or abstracts which they've presented. Our residents have done fabulously with presenting and winning accolades at almost all national and local regional competitions. So we are very proud of their achievement. They have been awarded podium presentations as well as those are oral presentations, as well as being given, nationally awarded best posters and best abstracts. So we are very proud of that achievement for our residents. Next slide. Like I said, because we've been part of a lot of clinical trials, we have the opportunity to publish in landmark journals. And these are a few of our journals where we've published our articles. And our residents in total had about 80 publications, including case reports, last academic year. So we've done great in that respect. Next slide. These are a few of the clinical trials which we are active now. These are stroke, COPD. These are pharmaceutical sponsored trials, as well as collaborations with the National Institutes of Health. I'm sure if you are in the US or you might have heard about the National Institutes of Health. So we collaborate very actively through various universities on studies with them. We are also part of their pandemic response, where they have this platform where new drugs are released or studied for upcoming pandemics. So we are part of that core group also for a study called Strive. Next. These are again a few of the collaborations we are into. We are part of All of Us research program, which was President Obama's precision medicine initiative, and we have collaborated with Fordham University, which is again a premier university in New York, as well as we've got new collaborations with University of Wisconsin now. Next slide. And these are a few grants which we acquired, and we've been awarded. We're still, I think, awaiting 2 grants which we've applied for this year. One is from the AHA, which is close to $500,000, and the other one from the New York State Department of Health. So very active, residents are very active. There's a huge support, faculty support, and administrative support also. Next slide. And these are just a few pictures. These are not, Dr. Evangelista is much more active in posting pictures, but these are just a little snapshot of what we've done this last year. Thank you.
So much, Dr. Menon. So Dr. Menon is pretty much a big deal in the field of research, and we're really happy to have that field assigned to her. So our next program leadership that you will meet will be Dr. Carmen Oviedo. She is one of the associate program director as well, but her field is in ambulatory care. She actually recently established our very first lifestyle medicine program that if it builds up in the future, all the residents will be able to rotate there as well. It's a very holistic way and approach for our patients, because they all have multidisciplinary problems. So Dr. Oviedo?
Hi, good morning. I'm Dr. Carmen Oviedo. Thank you, Dr. Evangelista, for the introduction. I'm also a graduate from Lincoln 2017. As mentioned, I'm one of the primary care physicians and also an associate program director for the past few years and director of lifestyle medicine program. For the ones that are not familiar with this concept, it's a specialty of medicine that is more towards a holistic approach of our patients to prevent, treat, or put into remission certain medical conditions such as diabetes, hypertension, and obesity. So I am in charge of the education of the residents in the primary care clinic and also to support them with any affairs or any issues that they may have during their primary care clinic rotation. And I'm just gonna share real quick why primary care is fundamental for your training, right? So primary care is the provision of integrated, accessible services by a healthcare team accountable for addressing a large majority of personal healthcare needs and developing a sustained partnership with patients, right? It is patient-centered, it is team-based, and community aligned and designed to achieve a better health, better care, and lower cost. So why is this relevant for your training, right? So the goal is for you during your training to gain the skills to provide high quality, coordinated, comprehensive, and compassionate care to the patients in a patient-centered model. We emphasize, of course, the diagnosis and management of acute and chronic illnesses, but a big part of primary care is preventive care, right? Disease prevention and health maintenance. This is what keeps our patients outside of the hospital and being able to have a more fulfilling and happier life. So when it comes to your exposure in primary care for the categorical residents, we have our continuity clinic. It's team-based. So you will be assigned to a team and you will have the direct supervision of one of our faculty, of one of our preceptors, who will be available for you throughout your training and during your rotation at all times. There, and you will see the patients with the preceptor and discuss each case with them. The clinic is structured on a weekly session. It could be morning or afternoon. This will be assigned to you when you join us. You will have a panel of patients assigned also to you, and that's the way we can ensure continuity of care and that you get the best of your training. So you can see how your decisions, how your management affect patient care. And this will be your panel during the 3 years of training here. Before starting each session, then we will have a discussion of a relevant topic that will be done by me with each one of you in an interactive way with question and answers that you will be that we will be going over together. The next slide, please. So there is a rotation called the clinic rotator for all categoricals as well, but this is where the preliminary residents have the option of choose this as one of their electives. And in this rotation, they will be exposed to primary care, but also to the acute care clinic, which we call, or urgent care clinic, which we call express care, and also to the non-medicine subspecialties such as OBGYN, orthopedic, and other medicine specialties as well. This is designed in a 2 or 4 week block, and it is, as I mentioned, for you to gain skills and practice in the outpatient setting. So we follow in our clinic the patient-centered medical home model. So this is defined as an approach to deliver high-quality, cost-effective primary care, focusing on coordinating patient care across the health system on a team-based approach. And this has shown to improve quality, patient experience, and staff satisfaction, as well as reduce costs. So we have a big team in our clinic. So you will have your nurses, of course, but also we have dietitian in the clinic, social worker. We have health advocates and community health workers for patients that have social needs. Because if you don't address those social needs or social determinants of health, of course, you will not be able to achieve a good control of their medical conditions. You have also the lifestyle medicine program, as we mentioned. You will have there the safety net clinic for patients with housing stability, just to mention a few resources that we have available. So it's a very comprehensive team. And if any questions, as Dr. Evangelista mentioned, feel free to just type them on the chat. Thank you very much.
Thank you so much, Dr. Oviedo. So yeah, that's actually three of us who are alumni here and decided to stay and work. So that says a lot of things about the program. And finally, the man of the hour, the program director, you'll be able to meet him. His name is Dr. Nihad Shabarek. He's also a proud alumni of the program. I'm not going to mention the date. So he's a program director, will give you a good like program in a glance, and about the hospital, he'll tell you some information about that. Go ahead, Dr. Shabarek.
Good morning, everyone. Maybe good evening for some people in different countries. Thanks for joining us. This is our first actually virtual open house for everyone. I just want to go over a few things about the hospital and the program. As you probably know by now, our hospital is part of Health and Hospital Corporation, which runs all the public hospitals in New York City. So we have 11 acute care facilities, and we have a lot of rehab facilities and SNFs and nursing homes, and a lot of multi-specialty clinics. So it's a huge operation, and it's actually one of the largest public health system in the world, budget-wise and number of patients-wise. So Lincoln is part of it, and the corporation treat the system as one system. So not every hospital has all the services in one place. So we kind of, interchange services among the hospitals in the system itself. For us, probably the main reason to transfer patients outside Lincoln would be complicated cardiology cases and requires interventional cardiology or cardiothoracic surgery. I actually just came back from a meeting with the CEO, the Chief Executive Officer. That's why I'm late. And we were again promised for the third time, but maybe for the last time, I hope, we're going to get our own cardiac cath very, very soon. So that's good news for us. Regarding the program itself, we have 116 residents. Every year, 34 categorical, and we have 14 prelim interns for 1 year. And the prelim interns are the ones who are going for either anesthesia or PM&R or dermatology or neurology or any other subspecialty. And we have some prelim who wants to continue in medicine also as VGY2 and VGY3. It's a very dynamic program. It's very fast-paced, I have to say. Our patients are extremely sick. And for multiple reasons. The good thing from your side is you will see a lot of sick patients. You will be able to handle them. One of the good things is we don't have a private physicians and private services, which mean that every single patient comes to the door are managed by you, by the residents, of course, under the supervision of the attendings. Lots of procedures, lots of complicated and unusual cases. Again, our patients are coming from everywhere, a lot of immigrants, and they bring their own diseases with them. So you see things which usually you don't see in the US. Regarding the application process, we have every year around 5,800 applicants, which is about. We do review all of them. Of course, we have certain criteria for the applications process, but we try to give a fair review for all the applications. Usually, we offer around 600 interviews or 650. It depends on the year. So around like 10% of the applicants. And this is usually for 48 positions as a first year, 34 categorical and 14 prelim. So it's a pretty tight process. And at the end of the match year, we're practically matching 1% of all the applicants that are applying to us. Again, doesn't mean much. Every single application will be reviewed based on our criteria, and everybody will be looked at regardless. If you want to look at our selection criteria, you can go to our website, and we have a few things in here written about this. All the interviews are online interviews. We do have open house, real open house, not virtual, which start after we start selecting the interviewees. And anybody is welcome to come in here. We will have at least 2 or 3 sessions. We can accommodate a lot of people who could come in here and actually see the place. And I really encourage all of you to any program you apply to, if you can, to actually go and see the place, because no matter how we can sell it to you, it's very different when you actually come and see the place. I know you heard a lot so far, and I don't want to take much longer of your time. I want the chief residents to kind of start their presentation. But I could assure you one thing: if you are serious about what you do and you choose us to be in here, you will get one of the best education you can. And I could guarantee that, and probably that's the only thing I could guarantee. But I will back my statement. So best of luck for all of you, and I hope we'll see many of you during the interviews.
Thank you so much, Dr. Shabarik. So after this, the chief president will present to you the slides and the question and answer portion. After the presentation, we invited several of our residents here. We have Dr. Amuche Alexander, which is our PGY2. We have Dr. David Serrano, which is our current categorical PGY1. And we have Dr. Sirin Dinser, which is our prelim resident PGY1, if you have other questions regarding residence experience. Okay, so I can see my two handsome guys there ready to do their presentation. Go ahead, guys, take the stage.
So, welcome everyone, and good morning, good evening, good afternoon, depending on where you are in this on this planet. My name is Amar. I'm one of the chief medical residents, academic chief medical residents currently, and I have my co-chief, Dr. Antia. He will introduce himself. He's an amazing guy.
Hey everyone, good morning, good afternoon, good evening, wherever you are. It's really nice to have all of you on the or to meet everyone today. My name is Akani Morantia, as you said. I'm one of the chief medical residents, and I hope you guys enjoy your time on the Zoom call today as well.
Okay, so we have a lot of slides to show you today, so we'll be moving ahead quickly. So let me share my screen, and this will sort of give you an overview of our program, the structure, the culture of our program. So I hope you like it, and I hope it interests you even further into joining our residency training. Okay, so let's start. So this is how our hostel looks like. It's located. Everyone is able to see the slides, right? Okay, so this is our hospital. It's located in the South Bronx. It's a safety net hospital, and we cater to a community with very complex medical issues and also socioeconomic issues. So it's a very fulfilling experience because you're like catering to a very underprivileged population. Okay. All right. So this is New York City. For you might have seen that in the movie. What you see, this is from the Hudson River, and what you see is basically downtown Manhattan. This is where you will see in the movie Spider-Man swinging around. But we are not there. We are somewhere up north where you can see the arrow. That's the South Bronx, and that's where we are located. So about our program, so we have been ongoing for more than 50 years. We have 116 residents, including PGY1 to PGY3. For the first year, we have 34 categorical positions and 14 prelims. We are fully ACGME accredited, and we have no citations. We have 56 faculty members across all IM specialties. We are a 64 bed hospital with 120 inpatient beds, including 40 telemetry and ventilator beds. And we have a 25 bed medical ICU. So our ICU is pretty big, and it's a very good rotation. So if you do measure, I'm sure you're gonna enjoy the ICU rotation. We have almost 11,000 admissions annually and 180,000 outpatient visits. We have our own fellowships. So we have fellowships in pulmonary and critical care, palliative and hospice care, and we have two new fellowships that we started last year. So that is infectious disease critical care. It's a combined fellowship as well as endocrinology. And we have an affiliated fellowship in HEMONC, affiliated with Westchester Medical Center. Our ED is the busiest, one of the busiest ED in the entire country. It's ranked sixth busiest in the entire nation with 145,000 visits. So you can imagine the amount of patients that you get to see, and your exposure is going to be pretty awesome. These are our achievements. So US News and World Report, it's a ratings agency, and they rate hospitals, they rate hotels, and for the year 2024-2025, we have been rated as a high-performing hospital when it comes to heart failure, kidney failure, and COPD. We're also leaders in LGBTQ healthcare equality, and we have been certified Gold Plus by the American Heart Association in management of heart failure and stroke. We are also considered as a baby-friendly hospital, and we are accredited by the NAPBC, which is an accreditation council for breast-related disorders. So, like I was mentioning about our patient population, one of the highest patient acuity index in the nation, and a population very diverse. So, you will have people who are from all racial and ethnic groups. So, you will have an exposure to a very diverse, pathologies as well. And not only that, you will be encountering, the bread and butter cases that we usually see, but you'll also see some zebras, some rare pathologies, and um, by the end of this presentation, you will know what I'm talking about. And something about the pandemic, that Lincoln was one of the major pillars of support, medical support during the pandemic in this community, and we cared for the highest number of patients in the South, in the Bronx, and second highest number of patients in the entire New York City. So now you may ask, what makes our program successful? So there are a few factors, and which will go in right now. So we have a very dedicated group of attendings and faculty members who are always ready to teach, and they're always available. There's never a moment that our attendings are not available. There's always an attending available. There is always an attending coverage, be it on the floors or in the ICU. So you always have someone to go to in case you are stuck with a patient or you have a complicated case which you probably would require some help. And they're also always ready to teach. As you can see in this picture, this is a noon conference where Dr. Sabarik is teaching an EKG. In the center picture on the left, you see Dr. Sabarik teaching intubation in the sim lab, and we have Dr. Khanna who is teaching lumbar puncture in one of her sim lab sessions on the picture on your right. We have a group of dedicated residents. As you can see, my friend, my colleague, my co-chief, Dr. Antia, is teaching EKG access. We do a good amount of procedures, so you get a good amount of procedural exposure and training. So you can see in the picture in the middle, we have Dr. Farouk, who's a second year, and Dr. Salahi is our new first year, new intern, and they're doing a midline, I presume. And then you see pictures from our similar sessions where senior residents are taking the lead in teaching junior residents. And the residents and the attending, they come together and work efficiently as a team. Like we say, teamwork makes the dream work. So that's how our program goes, and that's how we care for our patients. We have daily didactic sessions. So we have a morning report from 8 a.m. to 9 a.m. And then we have noon conference from noon to 1 p.m. And these are sessions where you get to learn. We present interesting cases. There are lectures on topics. Like yesterday, we had a topic on bacteremia by one of our IB faculties. So we are always a program in motion. We're always here and learning, and we're also teaching ourselves as well. Dr. Menon gave a good presentation on our research credentials, and this is like a short slide of our research work that we've been doing. And like Dr. Menon mentioned, that we have presented at many local and national conferences, and this is happening every year. Even this year, a lot of people are scheduled to attend many renowned conferences. And while you're here, and when you'll be here, you'll see that we recognize your efforts in pursuit of excellence. So every year we give out awards for those who have shown academic excellence as well as professional excellence. So you see these are our awardees for the last year, for academic year 2023-2024, and this is a tradition that we do every year. And you'll see that we are not only all into medicine. So after we at the end of our rotation, we go out as the team. The night team, there's a tradition that after the night team finish their 2 week rotation, they go on a breakfast before they go and get some rest. And every end of rotation, that's the end of every 4 week block, we have an end of rotation lunch. And you see in this picture, we are having some pizzas and pastas, but the menu changes. So it's not always pizza, so you won't get bored of eating the same food, okay? We have Jeopardy. So Jeopardy is basically our annual quiz competition. So residents get together from teams and we give some really innovative names. You see the winners on the bottom right. It's Team Hardstick. So we come up with some funny names for our teams and then we make sure that we put all our efforts into winning this competition. And we have a prize money. We get $1,000 for the winning team gets $1,000. So there's an incentive to play here. We are a very diverse program, and with all this diversity comes diverse food. So we hold this International Food Festival where residents bring recipes from their home country, and we get a chance to taste and experiences this diverse cuisines. And this has been very successful, and it's a very loved activity by all our residents as well as our faculty. It's not only residents, you'll also see our faculties bringing some food. Dr. Sabarik brings baklava, and he also brings some of the Syrian cuisine, to the festival.
Hey,
And
sorry, can you go back? Anyways, I cannot wait for you guys to test my famous jollof fries and fried rice. I really look forward to serving you guys with that food. It's like one of the best Nigerian cuisines ever.
yeah, and I did not know this thing that Dr. Antia told me that there is like a food rivalry between Nigeria and Ghana, and we have this year residents from both Nigeria and Ghana. So I'm actually looking forward to seeing that food
I mean,
rivalry play
Nigeria is
out.
always going to be the best, but I mean, that's just my opinion, I guess.
All right, so we'll move ahead. And like I said, we are a very diverse program and we celebrate all festivals. So you see this picture where we do our annual Christmas tree decoration and Christmas celebration, as well as we have iftar breaks during Ramadan. And we have a wellness room. This is where, if you have some off time, you can go, you can sit and relax, you can talk to your fellow colleagues and socialize. We have a ping pong or table tennis table there. We have foosball table there. So you can, blow up some steam, and, it's a very loved, destination among our residents when they're here. So this is our painting club sessions. This is something which has been sort of started by one of our third years, Dr. Choi, and it's been very successful. We've had 3 sessions until now. The last session was actually last week, last Thursday, and you see what we had our instructor, Miss Genesis Diaz, who's one of our social workers, and it was a very successful event, as you can see, and we look forward to having more such sessions in the future. Um, every year, at least twice, we try to go out on a departmental hike. So this is in either fall. So we go once in fall and once in spring, and this is something that we do every year, and we always look forward to these trips. And we also have our annual picnic in Central Park. So you see the pictures on the bottom. These are our pictures from last year's trip, and we're going to have this a picnic this year as well in September. A couple of years ago, we had a TEDx session where our sort of topic for the TEDx was healing power of sharing the story, and many of our residents were involved in organizing as well as they participated as speakers. I'll have Dr. Antia speak more because he participated as one of the speakers in this event.
I think during the time, TEDx actually reached out to us to organize this event. As he said, the theme of the event was healing power of sharing your story. So every single resident from different departments, not just internal medicine, we had residents from the emergency department, from pediatrics as well as OB/GYN come together to share their story. It is actually a very touching time because you would have residents share stories that you never expected to hear from them. And I think it was just a time to talk to each other, to reminisce on like probably your past and the future as well. And just to top it off, at the end of the session, I actually sang. I sang the song. I don't know if you guys know the Michael Jackson song, "Heal the World." So all in all, it was actually a very good session, and I think we're actually looking forward to planning something like this in the nearest future again.
All right. We'll move ahead. And this is our graduating class, the class of 2024. We have a graduation ceremony and then a graduation party, somewhere in the end of June. And yeah, this is where we bid goodbye and say thanks to our seniors for all the guidance that we received throughout our training. So these are the images of our computer lounge. This is where you'll be working when you're doing floors. And we also have male and female on-call rooms. So you can see we have a bed. So if you want to catch some rest, you can definitely do that. So what does the program offer you, right? So let's go ahead. So this is our schedule. So you see, we have made pie chart for the way the schedule works for PGY1 to PGY3. And you see in your first year, you'll be doing, so our entire calendar year is divided into 13 blocks of 4 weeks each. You'll be doing 6 blocks of floors in your first year, 1 week, 1 block of clinic rotation, 1 block of ICU, 1.5 block of nights. This will be ICU, mix of an ICU and floor nights. And then you'll be doing 2.5 blocks of electives. So that could, and focus rotation, which is almost mandatory for everyone. Also catch, which is rotation with our addiction treatment service. And some of you might opt to go to Bellevue Hospital for a PCU rotation. And we have 4 weeks, that is 1 block of vacation as well. So this is how our schedule is divided. So to talk more about the schedule, so 1 block is 4 weeks. Day rotation is 1 full block, 4 weeks. We try to minimize 2 week rotation during the daytime. Night rotations are always 2 blocks, so there will be never a time when we'll be doing 4 weeks of nights at a stretch. And you will work only for a maximum of 6 days or nights per week. So that's our cap. You can't work more than 6 days or nights. It's either closed on Monday to Friday, and then you'll be on call either Saturday or Sunday. And we try to give you some golden weekends as well. Same with NICU, you have like you work only 6 days, not more than 6 days, and we try to give you off on 2 Saturdays, Sundays during the block, and you get some days off in the week itself. Electives, they work from Monday to Friday, and on the weekend, you can either have a golden weekend or you could be backup or you could be working a night shift. It depends. But like I said, you won't be working all weekend. So we make sure of that. Nights, so like Sunday to Friday nights and it ends on Saturday morning. And the end of 2 weeks, people generally go for the breakfast that you saw earlier before. Um, how our coverage works. So during weekdays, if you're covering nights, you're off in the morning that day and the morning following day. Weekends, like I said, you can have a golden or you can be a backup call. That means if someone is sick or not able to cover the shift, you'll be called as a backup. And the good thing about this backup is you get paid for the backup. So if you're covering a backup call, you can claim and you get around $500 for each backup call that you do. Okay, we do not have any 24-hour calls. So when you're doing floors, you can either be a short call or long call. The short call is from 7 a.m. to 4 p.m. and the long call is from 7 to 8 p.m. So that's 13 hours. So we don't have any 24-hour calls. And when you're doing NICU, either day or night, it's 7 a.m. to 7 p.m. and 7 p.m. to 7 a.m. So that's 12 hours, no more. Um, the cap on the floor is 10 patients per intern, and for the night PGY1, when you're doing you're capped at 5 admissions and 2 MICU downgrades. Um, you have so people who are going to join us as categorical, you'll have a continuity clinic, so you'll be assigned, as Dr. Oviedo said, one clinic half day it could be either any day from Monday to Friday, but you will stick to that day throughout your residency. So if you're assigned, let's say Monday morning, you will have Monday morning clinic throughout your residency. And the same team, the same preceptor as well. And we also give 3 wellness days. These are the days which you can schedule in advance, and you can take off days, to, maybe meet some family or do whatever you like to do on those days. So you are not, these are not the days that you're supposed to pay back, and these are just for your wellness. This is basically sort of a pictorial diagram of how our teams are. I see someone is, I can see someone's voice. Can you please mute so we don't have any disturbance? Okay. So we have, like I said, this is the first diagram that you see is our day flow team. So you have 3 interns. There is 3 PDY1s, 1 PDY2, and an attending. Some of the teams, at least half the teams, will have a junior attending, which is a PDY3. So you'll have a PDY3 sort of doing the rounds and then confirming the plan with the attending. So the PDY3 will be running the team, and that sort of gives them more independence in management of the patient. The 9 teams are divided into red and green side. Red is basically the even. So we have 8 teams. So the red teams are the odd numbers team, and the green teams are the even number team. So you have 2 interns on each side with 1 PDY2 and the night attending. Then we have structure of the NICU team. You have 4 to 5 PDY1s, 3 PDY2s, 1 PDY3, and the attending. And you also have the pulpit fellows who are also part of this team and help you in managing the patients, and as well as they're involved in teaching and rounding as well. The night ICU team has 2 PDY1s, 2 PDY2s, and 1 PDY3 with the attending. And like we mentioned, the continuity clinic, you'll have PDY1, PDY2, PDY3 with the preceptor who will be your attending throughout your residency here. We spoke about didactics. I told earlier in this presentation that we have daily morning reports as well as noon conferences. Morning reports are the time when we sort of discuss some interesting cases that were admitted to our teams or overnight. And we sort of go over the management and see if there are any scope for improvement, something that we could have done better. So it's a very interactive session, and everyone looks forward to joining this daily morning report. We also have noon conferences where we have our faculty from different subspecialties come and give a small talk. Sometimes we also do questions along with these lectures, so we're sort of consolidating the knowledge that was given in the talk with the questions. We also do every weekly we do grand rounds. So these are where we have like speakers who are experts in their field. They will come and give a talk. We had a grand round this morning. It will be about the treatment of Clostridium difficile infection and what are the new and emerging treatment modalities that we might see in the future. We also do monthly morbidity and mortality presentations. So these are cases which sort of didn't turn out well, and we try to analyze again like what were the misses and how we could have improved and how we could prevent such things from happening again. Again, these are all resident driven, so it's how creative and thorough you can be to make these presentations really worthwhile. And we have, and like I said, we have like faculties in every field, so you have a chance to rotate in all specialties, including neurology, nephrology, cardiology, infectious diseases, pulm, GI, endocrine, palliative care, rheumatology, geriatrics, and catch. Catch again, which I said is our addiction medicine service. And you have also some optional electives as well. These are basically for preliminary residents who are going to go in these fields or applying to these fields. So we have optional rotations in physical medicine and rehabilitation, radiology, dermatology, trauma, surgical oncology, as well as anesthesiology. And we also really emphasize that residents be teachers as well. So you will have in your flow teams as well as ICU team, you will have students from St. George's University as well as New York Medical College, and they are an essential part of the team as well as the team that takes care of patients. And you have a chance to teach them, and and improve your skills as a teacher as well. This is basically a layout of how our morning reports and noon conferences work. We have an established mentorship program. So during when you start your residency, we will talk to you. We'll know about what interests you, what are your future goals as far as your career is concerned, and we will assign you a third year mentor who will be helping you out throughout the year. And you will also have an opportunity to choose your own attending mentor. And this could be any faculty. Like I mentioned, we have 56 faculties across all IM subspecialties. So if you want to, let's say, do infectious diseases, you can ask one of the ID attendings to be your mentor, and then he or she can help you guide throughout your residency to make sure that when you apply for the fellowship, you have the best possible CV to get those interviews and get those positions. We also have a peer-based learning, a PBL rotation in second year. These are the residents who are sort of chosen by our program leadership to sort of help out the interns, because I understand even the first 3 months of internship are pretty hard, especially if you're an IMG, because you're coming from different parts of the world, and you are expected to adapt and learn a very different culture within a few weeks. So these are PBL, they're PDY tools to sort of help you transition and make sure that you sort of know the system and know our electronic medical record and don't have any trouble navigating that. We have a feedback system, so at every end of every rotation, you will get a feedback form on your email, and you're expected to fill it out. And sort of you will be evaluating your attending, you'll be evaluating the rotation itself, and you'll be evaluating the medical students as well as the co-residents. And this feedback is what drives improvement. So we really put emphasis on completing this feedback. And every 6 months, you'll have your meeting with Dr. Sabarik, and he will go over all your evaluations and sort of figure out if there is any need for improvement, or how you can sort of be better in certain things so that you achieve your desired goals. Like I said earlier, you can get to rotate at Bellevue Hospital. Now, Bellevue Hospital is a part of New York City Health and Hospitals healthcare system. Bellevue Hospital is one of the oldest hospitals in the entire United States, and this is where we go for our coronary care unit rotation. It's a very unique rotation, and for those of you who will choose to go here, you will experience a lot of sick cases, but it will be worthwhile. I enjoyed it, and I will ask Dr. Antia again, who's applying for cardiology, to speak more about this rotation.
Hey guys, so as regards the BCC rotation, as the name implies, is the coronary or cardiac units, critical care units as well. You actually have like a whole month of this rotation. You're going to be taking care of high acuity cases as regards the heart, like mechanical circulatory support. You're taking care of patients with myocardial infarctions, with heart failure, patients in cardiogenic shock. You're going to be taking care of patients that require probably external machines to actually help the heart work. You're going to be working with established cardiologists, and you're going to also have the opportunity to do research with them, get mentors as well, and probably write like really cool case reports as well. As he said, it is one of the oldest hospitals, it's well established, and we have a very close relationship with them. You are going to have the opportunity to rotate, and you can also ask to rotate there as well. So it's actually for those of you interested in cardiology, or basically everyone that goes into internal medicine, you're going to get like an adequate exposure to the workings of the heart and the management of high acuity cardiac cases.
Thank you. And okay, this is a slide about our point of care ultrasound rotation, and now we're very proud of this rotation because not a lot of hospitals have this. We have a dedicated focus rotation which every resident goes through. It's a 2-week rotation where you learn about the basic ultrasound of the heart, the lungs, and the abdomen, as well as vessels. It's a much love rotation. So you go and do your, you find some patients, you do ultrasound, and you record those images. And in the afternoon, you will sit down with either Dr. Sabarik or Dr. Evangelista, and we'll go and they'll go over your images and see, if they'll see about any improvement has to be done regarding your technique, as well as they'll discuss the findings. So it is one rotation which when I joined, I looked forward to, and I really enjoyed it. And it comes very handy because, like I said, we have a very robust ICU service, and when you rotate in the ICU, you do a lot of focus because these patients require such level of care. And these are some images from our focus rotation. You can see Dr. Bao, Dr. Henry on the top picture. These are our, they were interns back then. Now they're PGY2. Dr. Bao was the surgeon. He joined neurology at I think University of South Dakota. I'm not sure. Then on the right you have our focus in doing a bubble study, and then you see the picture below. You see Dr. Evangelista and Dr. Alejandro Halo Carrasco, who was our film resident. They're discussing their focus findings. Research rotation is a 2-week rotation which can be requested if you have some research projects that you want to complete. This rotation is again supervised by Dr. Menon, and yeah, you have to get some prior approval. These are pictures from our sim lab. As you can see, these are our sim lab procedure training. These are all, again, both resident and attending driven, and these are mock code training that we do in the sim lab. We are from everywhere around the planet. As you can see, maybe a few dots missing, but you see we are from around the world. So I'm gonna go a little quickly. This is our board passing rate. So in 2023, we had a 95% board passing rate compared to 88% average nationwide, and it's been going up as you'll see. This is how we performed last year. And this is a year-on-year graph. As you can see, the dark blue is where we are at, and the light blue is where the national average is at. And we are always better than the national average, and also year-on-year we are improving. Where we go, so you see, this is a list of all our residents, former graduates who have gone to different fellowships around the country. So this is from class of 2022, and you can see that they are going into all varied specialties across internal medicine spectrum. Then this is the class of 2023. They went to a lot of great places, and now we have our latest graduating class of 2024. As you can see, people are matching into concrete, cardiology, infectious diseases, hemonc, nephrology as well. And okay, what does the South Bronx look like? This is what the South Bronx is, right? It's a very diverse community. We have the Yankee Stadium here. So you might have a chance to catch a baseball game every now and then. I'll talk briefly about the benefits that we have. So we have health insurance plans which are provided by the hospital. We also give family and medical leave, some supplemental benefits. We also have retirement savings plan. You also can get a Metro card from the HR department here, so that covers your transit cost. And we have salaries, so we really had a bump. Recently had a bump up in our salary, so now you'll be getting paid around $78,000 as a first year, $81,000 as a second year, and almost $88,000 as a third year. So other benefits, so these benefits are through this committee of interns and residents. So you get dental insurance as well as vision plan. You also get some maternity benefits as well as psychiatry benefits. There's a 35,000 meal allowance that comes with every paycheck. So it's sort of divided over the 12-month period. You get around $1,000 of healthcare expense reimbursement. So this you can use for your prescription drugs if you need any. Same with the $500 prescription reimbursement. $750 per year is medical education reimbursement. This you can use to pay for your step 3. You can use it to buy a new laptop or a phone. So in my first year, I used my $750 to get a new phone, and then in my second year, when I gave my step 3, I used the same money to pay for my step 3 exam. You also get $1,500 for conference as well as board review exam reimbursement. So you can use this to buy MidSap, which is like a question bank, which is used for board preparation. You see that a lot of patients that we have speak Spanish. So you might have heard of Rosetta Stone. It's an app which you can use to learn Spanish, and you can get a free access to it via CIR. For those who have children, you can claim $5,000 per person in childcare reimbursement, and we also have $5,000 per year for mental health as well. We have a plethora of educational resources at our disposal. So we have a youth physical library on our second floor. We have the latest and fast print issues of all leading journals as well as the textbooks. We have an online medical library with full access to New England Journal of Medicine, Journal of American Medical Association, as well as Annals of Internal Medicine. We have full unrestricted access to reference resources such as up-to-date clinical key and micromedics. And all PDY years, so PDY 1 to PDY 3 will get access to Learn Question Bank. It has around 1,800 questions which are updated every year. And the third years will get access to UWorld for the internal medicine board exams. Okay, so why would you choose Lincoln? We have great clinical experience and exposure. We have a huge and ample opportunity to perform procedures. The workload is not too bad. We have great opportunity to pursue fellowships. As I said, our residents and graduates have gone into very great fellowship positions, and New York City has a lot of things to offer as well. So with this, we will open, the session to questions. You can send your questions in the chat, and we'll try to answer them. And we have some of our current residents who will try to answer that as well.
Thank you so much, Amar. So I wrote down, I was a silent reader of the questions that are being talked here, some of which have been answered eagerly by Dr. Shabarik. So there are some questions. Let's start with the selection committee criteria, which has been a recurring question. So the first question, which I prefer Dr. Shabarik to answer, will be, do we participate in signaling and like geographical references as far as like in the application in ERAS?
We don't. I think, I don't know, we tried it last year and it didn't really work well for both applicants and the program. So as I said, we just really just go over every single application and we just, make a decision based on our selection criteria.
There's like a question about graduation year cutoff. What is our preference? What the selection?
Our preference is 7 years, but again, I want to repeat myself again. Every applicant is different, and if you're 8 or 9 years, but you have a fantastic CV and experience, absolutely, you're part of the deal.
USMLE attempts. What's our stand with that?
Usually, we don't take repeaters, but go back to my first remark.
So all the applications are being reviewed very well by the selection committee. So even if, you don't meet one criteria, you might meet other criteria that we will consider. Research profile. So does it count if an applicant has a lot of research work?
It's a plus, but not having researches is not a minus.
All right. I think the question regarding preceptor and student ratio has been answered by me and Dr. Oviedo in the chat. Now, are there any voluntary activities available for residents?
What does that mean?
Probably, let me just answer that. Maybe like community service outreach, like something that they can sign up for.
When we do have a couple of residents now doing some community outreach programs on their own. I'm part of the hospital, but they've practically started the process in there. Yes, we do, but not for everyone, not as a structured program yet.
All right. And there's a question that I think I can answer. The affiliation of the Lincoln Hospital to different universities in the US. We're affiliated with Cornell University, where of the faculties are affiliated with the New York Medical College and St. George's University. These are faculty affiliations because we have medical students coming from different medical school that rotates with us. So that is actually a teaching opportunity for our residents to practice. All right. There's a question regarding access to simulation lab. You already saw the pictures that we did several procedure courses in the beginning of the year, around August, where all the PGY1 are mandated to attend. Central lines, lumbar puncture, intubation classes, and then, succeeding, there are our chief residents are organizing procedure training if you want some more. So everybody has access to SimLab. Dr. Shabarik, they're asking for away rotation.
Away rotation is very complicated as a resident. Being student or foreign student would be much easier. As a resident, we have actually to get the approval from ACGME, which is a very, very complicated process, and justify why we're sending our residents outside of our main program. So it's pretty complicated. And the first question ACGME asks is why we're sending our residents outside. And that should be because of lack of service in the hospital itself. And that's what we do for our residents to go for CAS and CCU at Bellevue, because we don't have cardiac cath. Other than that, we do have all the basic requirement for the IM training program by ACGME criteria. So the short answer is no, because as I said, it's very complicated and it has to be universal for all residents, not based on one resident at a time.
All right. Now, visa. What kind of visa do we sponsor?
I saw that question and I was actually amused with this. 90% of our residents are on foreign graduates, and many of them are on J1 visa. So we are very FMG families.
What are the challenges of having a huge patient population and how the residency program manages it?
The workload is exactly at or below the ACGME requirement. So we do have enough residents, we do have enough workforce, and the number of admissions, number of patients you carry per day, all those criteria are 100% met for the last million years. So we should be okay.
Does the program accept EAD or it has to be shifted to J1?
J1 or H1. I just spoke to the CEO again today about the H1, and we're trying to push to get resident with H1. But you have to have a valid visa which allows you to work in the US and get a salary, and that will be either J1 or H1, of course, green card and citizenship.
Does it really matter for us to give a point somehow of consideration regarding clinical experiences, either within America or outside America, like UK?
Absolutely. Anything extra is good, but lacking of those is not going to change. It's not going to make your application, go downhill. We know that a lot of applicants cannot come to the US for experience. We understand that absolutely, and we know that some of you are just very fresh graduates and you didn't have time to do any experience, which is perfectly fine.
We are running out of time, but we have a few more. General question: what are the qualities the program look for? Just lay it out there, Dr. Shabarik. And then after that, I think the next question that
somebody who's very serious, who's here to learn and get the most out of the training.
All right. And there is a question a while ago regarding the level of support from the program and in their instances that the program got your back. I think I will leave that question later on to the chief residents and one of the selected residents that we have here to answer that, because that one applicant actually is asking for specific instances. There is another question, probably last of the few. Would you consider applicants who only have telerotations as clinical experience?
Absolutely.
All right. And how does the program support residents in managing high volume of complex cases while ensuring ample opportunities for hands-on procedural experience? I think it's a competency for skills.
Exactly. I mean, as I said, we go by the ACGME criteria and we meet all those criteria. So even though, it looks like we have a very high number of patients, but our system and our scheduling allows everyone to be, to meet those criteria and not get overwhelmed and burned. Maybe not in July, maybe July, it's a bad month in general, but after that, and you have enough support from the program, the faculty, the attendings, the other residents from everyone around you. So shouldn't be worried.
All right. Last question. I think this one is for Dr. Menon. if she's still with us or if she attend the meeting. It's like, how much autonomy do residents have in collaboration with Dr. Menon as far as clinical trials are concerned? Is she still
So
here?
unfortunately,
Oh, there. Hi,
yes.
Doc.
Thanks, Carla. Unfortunately, clinical trials, because they are very strictly regulated by the FDA, we need competent people doing trials. So I do have a dedicated research team to do that, but residents are welcome. And most of the times we do a lot of these studies on inpatients. So residents are actively involved in helping us screen patients as well as identify patients, and even they are helping us follow these patients for adverse events or study related formalities. So in that way you can get actively involved in the clinical trials, but formal involvement is unfortunately not allowed because of regulation. Hope
All
that
right.
helps.
Thank you, Dr. Menon. So for the remaining 5 minutes, I think us faculties will have to exit the meeting now, to for you to ask the chief residents and some of my residents, about residents' experience. So as to say that I'm not looking at Amar's eyes and say he should shut up. Okay, so I really am happy that all of you, almost 200 people attended this virtual seminar, and I really want to see you in person through the interview. So good luck. All right. Any parting words, Dr. Shabarik, before we log up?
Good luck, Denise. We'll see you soon.
Thank you so much. So faculties will now sign off, and then 5 minutes for Dr. Amar, 5 minutes for residents' question, and I think we're done. Thank you. See it in YouTube. We will upload it soon. Thank you.
All right, guys. So we had this one question on what kind of support the program provides, and if there is any particular instance that we can mention in particular. So I can tell you from my experience, when I was a first year, one of our co-residents was in her third trimester, and that was her last rotation before she went on a maternity leave. So obviously it was not very easy for her to sort of, manage all her patients. So we always made sure that she had all her patients in the same floor. Now, the way our floors are divided, and you have patients on the ninth floor, eighth floor, as well as the sixth floor. So we made sure that all patients that she had were on the eighth floor. Like if we had a patient on the eighth floor and she had someone on the ninth floor, we made sure that we took her patient and gave her the eighth floor. We sometimes also covered her on her call days, and that's how we made sure that her trimester going into her maternity leave was comfortable for her as we could make it. Let me go through any other questions.
So holistically, yeah, we are just one very big family. I hope you guys are hearing me clearly. Just one very big supportive family. Yeah. If you have any, should I say, fallout, you're always there to cover your back, or we have your back almost all the time. But we always encourage everyone to hold his ground and be efficient in number one. We're here to support. That's one thing I learned, but that's one thing I encountered in the program. We have a very good and strong supportive system.
Okay. There's a question whether we offer observership or an audition interviews. No, sorry, we do not have those. We don't offer those opportunities. Let me see if any. So there was a question regarding what kind of fellowship support do you get from the program and the faculty. So I believe I will give it to Dr. Antia. He can answer this question.
As regards fellowships, yeah, we have like great faculty that are willing and ready to support you, to mentor you right from your PGY 1 to your PGY 3. Always remember that the mentor-mentee relationship is a two-way road. What you give is what you get. If you show initiative, you're going to get a lot of support as well. We also have what do they call this thing, like interview sessions with the faculty as well. Probably close to your interview season. They'll help you out with interview training. Like the letters of recommendations are are definitely going to come, especially if you show initiative, as I said.
Okay. So a question on how does the program leadership respond to feedback from residents? So with like, yeah. Um, so we, like I mentioned earlier, we have this evaluation system, and Dr. Sabarik has an open door policy. So if you have any concerns that you want to bring to him, you can actually go to his office and let him know your concerns, and he makes sure that we take care of those concerns. Uh,
It's a question for David or something.
yeah.
Okay.
We have a question whether our program has free parking or gym. We do have a small gym, and it was a few months ago they got some new instruments there. So yeah, we do have a gym. Do we have free parking? No, we don't have a free parking, but we have discounted parking for all house staff. So that includes attending as well as residents. So I believe the fee is like $100 every month, if I'm correct. I don't have a car, so I can't give you like the minute details, but we don't have free parking. Um, Cost of living. So it's New York City. The cost of living is obviously higher than any other city in the United States. But like you said, we had a bump up in our salary. So we were getting like somewhere around 66,000 as per year as a first year when we started. When you guys joining, you will be getting around 71, 72,000. So it's a big step up. So I think that should cover all the costs, and you might be even be able to live your dream, get a dream apartment in Manhattan. So um, do we offer pre-match offers? We do not offer pre-match offers. It's only we participate in the NRMP match, and this is how we match people. Um, Uh, on a question on signals, Dr. Shabarik already answered that. We do not we do not use signaling. We review the applicants as a whole. Okay. What is the mentorship for research like? So I think this question has been answered before, like Dr. Antia said, that you will choose your own mentors to work with. And a lot of these faculties are actually involved in research. So like if you want to, if you're aiming for cardiology, chief of cardiology is very actively involved in research and mentoring those interested in pursuing cardiology. But again, we have a very active research department under the guidance of Dr. Menon, and a lot of us do research with her, and we bring our ideas and research products to her, and that's how we do research. Do we have independence? Yes, we do have a lot of independence in clinical decision making. However, you will be always supervised. So if you have an idea as to how to manage your patient, or you have an assessment and plan, you can always discuss with your attending and with the PDY too to make sure that you work as a team. Like I said earlier, teamwork makes the dream work, and we work as very efficient team to deliver quality patient care. Um, Someone is asking, they're in New Jersey, so do people commute? Yeah, so there are people who stay in New Jersey and they travel by car. Um, and yeah, so I think, yeah, Dr. Denser already answered that, it takes around 20-25 minutes by car, depending on where you stay. And you want to make sure that you don't get caught up in the rush hour, so you want to avoid that. If a resident makes mistake, how does faculty react to it? Okay, so I think mistakes happen. It's a part of the learning process, and our residents, our faculties actually know that you have that even they have gone through residency and also faced similar situations. So the way it is like we try to sort of dissect what happened and try to go over what happened to make sure that it doesn't happen again. So it's we try to make it as a learning experience, and it's not about pointing blame at anyone. So that's how we work.
I mean, just remember that every mistake is a learning experience. Yeah, and our faculty, as I said, nobody points fingers. Everybody just aims for your improvement and your betterment, and you get to just learn from every mistake you make. Remember, you're always gonna have an attending with you or a senior resident for supervision as well. So you're always gonna have support. That's the major thing.
Right. So just to add to that, the one thing which we are very strict about is professionalism, and acts of unprofessional behavior, we take it seriously. So like in all fields, we expect you to be polite, courteous towards your patients, towards your fellow residents. We expect you to be on time, because if you're not on time, the team that is going to sign out to you, they will be delayed, and that's not fair on them. So this is something we try to inculcate in all our residents, to be professional at all the times. A question on what EMR does our program use? So we use Epic, and if those of you who have any information about the electronic medical records, Epic is one of the best EMRs. It's very user friendly, very flexible. You can customize the interface to your liking, to make sure that the information that you are looking forward, or you look for, is always there right in front of you. Let's see. Okay, Dr. Serrano answered about the living expense. It's a childcare service in the hospital. So we have, like I mentioned, through our union, which is the Committee of Interns and Residents, you have a $5,000 reimbursement for childcare, which you can apply for. So Dr. Serrano mentioned that he's living in Harlem with a roommate who's also a resident in Lincoln. He's also mentioned about the transit cost, and he's like paying $1,500 per month. So with your new salary, you'll be getting close to $5,000 after the tax cuts a month, and you're paying around $1,500. So that's not too bad to live in Harlem, which is a good location to stay in. Does the program have a good work environment? Oh, it has an amazing work environment. Like,
It's the best actually. It's
yeah,
literally the best. As I said, the support system here is amazing. There's an open door policy. You can walk into any attending's office, the program director's office at any time. Our GME office as well. We have an extreme open door policy and a very friendly staff. Okay?
and like I said, we have like a mentorship program. So if you have any concerns regarding your personal life or your career, you can always bring that up to your mentors, and they're always happy to help. And we, like I said, we always have a PDY3 mentor as well as an attending mentor. Someone is asking, what are the qualities your program is looking for into the residents? So our program, like Dr. Sabarik mentioned, we look at the application as a whole. What we are looking for is people who are eager to learn, who are humble, and like I said, we are looking for people who are really professional in their behavior, because we want people to be nice, polite with each other, because that goes a long way in delivering good patient care as well as being a good doctor. Uh, how approachable are attendings in the program? I believe that has already been answered. Uh, okay. If there are no more questions, I'm gonna wait for a minute. If you have any more questions, or if any question which I may have missed, you can type it down and we'll try to answer. Regardless, you on your screen you might see two QR codes. The one on the left is to all our social media handles. This is for YouTube channel as well as Instagram and Facebook. Um, and on the right, you have there is a channel called Clinical Problem Solvers, and we presented a very unique case. It's like a 1 hour session where we discuss how we sort of approach the case. So you can look at it and see what kind of diseases and pathologies that we actually get to experience here at Lincoln. Uh, okay. Let's see. Does the program accept letters, emails of interest? How to go about it? Um, I'm not really sure about this question, but like Dr. Sabarik said, we get 5,000 applications every year, and then we try to interview around 10% of those applications. So you imagine the amount of. It is possible that your email may get picked up. It is possible that your email may not get picked up in all those emails. So um, yeah, so that's the reality. I mean, there's so many applicants. We try to answer every email, we try to answer every query, but again, we try to triage or prioritize the emails that we answer.
I mean, the thing is, we can never fully review. I mean, I'm applying to fellowships at this point, and I'm also contemplating that question: should I or should I not send letters of interest? And from what I hear, it has no bad side and it has no, like, it's not detrimental. If your letter gets picked up, fine. If it doesn't get picked up, there is no bad side to it. I don't know if that makes sense. So if you want to send a letter of interest, fine. If you want to send, but the thing is that we might not actually get to read it. I don't know if that makes sense.
Okay, and if you do send in a letter of interest, please sort of try to personalize it. Like, what are your qualities that would match our program, and why would you gel well with it? So, I mean, that's a kind of a letter of interest which is more likely to get picked up than something which is very generic or similar. All right, guys. Any more questions? Right, and I'm going to write down emails of the program as well as the chief medical residence email, and you can direct all your questions to us. And if you have specific emails for any one of the faculty, we can then forward your emails to them and they can answer it. Okay, so I'm going to write down in the chat, so please note down those email addresses. All right, guys. Everyone have a good time, and we look forward to seeing you in the interview season. Okay, and all the best to everyone. And I really hope that you achieve, what you have set out for. And good luck to you all. Okay, that's it from us. And goodbye, and take care.